good afternoon. I'm here today with Alberta's Chief Medical Officer of Health, Dr. Hinshaw, to provide an update on COVID-19 in the province. Currently, the number of lab-confirmed active cases is 19,050. That's down by more than 2/3 from the peak of 71,000 that we saw on January 16th. And virus levels in our wastewater monitoring continue to drop, as we'll see in a moment. These are signs we want to see as we start our first week with no mandatory masking for children and youth in schools. Of course, we respect the rights of children, youth, and their parents and guardians to make their own choices. We're balancing the current risk of COVID transmission in schools while supporting overall mental health and physical well-being for students. And a reminder, there's one thing everyone can do to lower their risk and the risk to their kids, and that's to get vaccinated and get their children vaccinated. Starting today, youth who are immunocompromised or have an underlying health condition can book appointments for booster doses of COVID-19 vaccine. Dr. Hinshaw will have more details in a moment, but I know this is welcome news to parents and guardians who are doing all they can to protect their children. We're moving forward based on the evidence and balancing the risks to the health system with the cost and harms from restrictions. This balance has guided our decisions from the start of the pandemic, and as it has in other jurisdictions. The approach has not changed, but the pandemic has changed, and so has the data here in Alberta. Canada's Chief Medical Officers of Health see the same data, and in their statement yesterday, they agree the evidence supports rebalancing our efforts towards a more sustainable approach to the long-term management of COVID. When and how this will happen will vary province to province, but it's time to begin this transition. And the majority of Albertans agree with this view. A recent poll found that 57% of Albertans support removing restrictions. This week, another poll says it's 2/3 of Albertans. And the same transition is happening around the world and across the country. Just yesterday, Ontario accelerated their reopening. Every day, other jurisdictions of every political stripe are making similar decisions based on the same evidence. So let's take a moment to look at where we're at here in Alberta. One of the leading indicators of COVID-19 levels is the signal we see in the wastewater. Using that data, we could start to see the shape of Omicron wave about 6 weeks ago. In Edmonton, the wastewater signal peaked on January 3rd. But of course, we didn't know that at the time. We had to wait and let the data show the shape of the curve. By about 3 weeks ago, we could see that the wave was passing. This pattern is similar in Calgary, but even more pronounced. And to show you how strong this trend can be, the next slide shows Banff. It's the clearest picture of all the 19 sites where we have data. It's an interesting example because there's so much movement back and forth between Banff and Calgary, so it peaked right after Calgary did. Banff has a young and active population with a lot of contact, and unfortunately a relatively low vaccination rate in younger adults. This graph shows the distinct Omicron pattern, up very fast and down just as quickly. And one other critical point, the fact that the level is so low doesn't mean it will stay low. This wave was brought into Banff by visitors just as COVID overall was brought into Alberta from outside. It can come in again. In fact, we should assume it will. But right now, the level is falling fast. Wastewater levels and case data are leading indicators. They help show when the risk is going up or down over the next few weeks. But the risk we have to manage, the basis for our restrictions, is the burden on our healthcare system. Based on the surge in virus levels and our experience in previous waves, we prepared for a wave of hospital admissions that would have the potential of disrupting our system. Going into the Omicron wave, we kept restrictions largely in place from the Delta wave, and in fact, we increased them. But the pandemic changed. The wave of excess admissions that we were prepared for is not happening, and there currently is no basis for us to expect that wave of hospitalizations to happen. So as soon as that was clear, we made the decision to move forward and to ease restrictions. The number of patients in our non-ICU hospital units remains within their normal capacity and in line with mid-winter levels before COVID. Over the past week, there have been around 5,200 to 5,400 non-ICU patients in total. On Sunday, there were 5,250. That's an occupancy rate of approximately 90% of the normal pre-COVID capacity in those units. And it's lower than the number of patients in those same units in January of every year from 2015 to 2019 before COVID. The level in those years ranged from about 5,400 to 5,600. Vaccination changed the pandemic. A third to half of COVID admissions are now incidental. So the number of COVID positive patients in hospital doesn't mean what it did just a few months ago. And length of stay has dropped. So the average admission today means less burden on the hospitals than a few months ago. But I want to be clear. The people who work in our hospitals are still under strain. We owe them a huge debt of gratitude. And more than that, they need relief and they need to get back to working in more normal conditions. COVID has not gone away. It's still causing severe illness and death, especially in the oldest and most vulnerable people and people who are not yet vaccinated. But at a system level, the current wave is not causing hospital admissions in excess of the levels we would see in a normal winter. The number of COVID patients in our hospitals has been on a downward trend since February the 7th. It's dropping, and it should continue to drop in the coming weeks because new admissions have fallen almost every day for the past 3 weeks. They peaked at about 36 per million population on January the 26th, and on Sunday the rate was 24, 1/3 lower. So again, the data has changed just in the past couple of weeks. Starting about 2 weeks ago, it looked like we had passed the peak in admissions, but we had to wait to be sure. Now we can see it. New admissions are trending down, and the number in hospitals are trending down as well. And that's in line with other jurisdictions. In Ontario, for example, the number in hospital began a sustained decline about a week after new daily admissions started to drop steadily. We're on a similar curve, a couple of weeks behind them. That's the core evidence behind our reopening. It's the same evidence other jurisdictions are following in making the same types of decisions. I want to emphasize, the reopening plan depends on these trends continuing. If they don't, we'll take action as necessary, including reimposing restrictions if we have to. And our success in keeping COVID at bay ultimately depends on following the orders of our Chief Medical Officer of Health and on vaccinations. We need to keep working hard to get more Albertans vaccinated, including third doses, second doses for younger kids, and third doses for kids at higher risk. More than ever, we must be vigilant about our health, get vaccinated, and if you get sick, stay home. If we work together to keep each other safe through this transition period, I have no doubt we will come through it successfully. Thank you, and I'll now invite Dr. Hinshaw to give her update.
Thank you, Minister, and good afternoon, everyone. I just inhaled some water, so excuse me. Before I get to the data update, I want to provide information on a change being made today to eligibility for early COVID treatment for those at risk of severe outcomes. We have seen that a single dose of vaccine is not protecting people against severe outcomes as well as 2 or 3 doses. So beginning today, anyone 55 or older who is unvaccinated or has only had a single dose of vaccine would be eligible for early treatment with either Paxlovid or Sotrovimab. This means that individuals in this group who have even mild symptoms should access PCR testing as soon as possible. So if they are positive, they can be referred for a conversation with a healthcare provider on available treatments to lower their risk of severe outcomes. This is also true of anyone 18 years old and over who has a clinical risk condition like diabetes or heart disease and has either no vaccines or a single dose of a 2-dose series. Finally, anyone 18 or older who has a significant immunocompromising condition, like having had a transplant or being on active cancer treatment, is also eligible for early treatment, even if they have received all doses of vaccine. Over the last 24 hours, we have identified 838 new cases of COVID-19 and completed about 2,500 tests. Our positivity rate for lab-confirmed cases is about 33.9%. Turning to hospitalizations, there are currently a total of 1,538 people with COVID-19 in hospital, including 123 in the ICU. Sadly, 14 new deaths were reported to Alberta Health over the past 24 hours. While I know we are all tired of hearing about COVID, the reality is that it continues to cause severe outcomes, and it is important that we factor this into our daily routines. My condolences are with the loved ones of the people who have died, and with anyone in Alberta who has lost someone important to them, no matter the cause. As of today, only 2 of the more than 2,500 schools in Alberta are in temporary at-home learning to address operational challenges. Alberta Education will continue to work with school authorities on school shifts to at-home learning. It is encouraging to see a continuing declining trend. Less than 0.1% of schools are now on temporary at-home learning. School authorities continue to have the flexibility to shift a class or an individual grade to short-term at-home learning to address operational challenges at schools if needed. As the Minister mentioned, vaccine appointment bookings open today for third doses in the primary series for children between the ages of 5 and 11 who have specific significant immune-compromising conditions, and third dose boosters for youth aged 12 to 17 who have underlying health conditions or are First Nations, Métis, or Inuit. As well, adolescents between the age of 12 and 17 with immunocompromising conditions can now receive a 4th dose booster to help increase their protection from COVID-19. If you were wondering if your child is eligible for an additional dose, I encourage you to review the list of conditions at alberta.ca/vaccine or speak to your healthcare provider. Appointments can be booked online or through the Alberta Vaccine Booking System or by calling 811. The province is now in a period of transition as we begin to shift from a pandemic response to an endemic one. This is a shift all provinces are undertaking. As the Minister mentioned, a joint statement by all Chief Medical Officers of Health across Canada was issued yesterday, highlighting the beginning of a move across the country to transition towards an endemic phase of COVID-19. After nearly 2 years of requirements to modify the way we have lived, worked, and socialized to help reduce transmission of the virus and protect each other, it's going to take time and effort to adjust away from mandates and towards personal risk assessments and actions. For some Albertans, this transition will seem quick and easy. For others, it will be much more challenging. And for many people, it will likely be somewhere in between. There is no one right way to respond to these changes, so we should expect different responses. Every person's experience through the pandemic has been unique, depending on the challenges they have faced. COVID risk to individuals and the population is not a binary on-off or yes-no state. Some people will continue to be at high risk individually of having a severe outcome should they be infected. As a population, we will continue in the short term to be impacted by the COVID patient load on hospitals, which is being managed capably by healthcare teams, but is not yet back to a baseline state. Also, both as individuals and together as a population, we have all had impacts in our lives from the protective measures that have been necessary to use throughout our various waves. As we move forward, it will be vital that we find a way to respect each other's previous experiences, comfort levels, and risk context, different as they may be from our own. This includes seeking to understand and provide space for actions of others, especially if they are taking different precautions than the ones we are taking. I particularly want to thank parents and educators for their work to support our kids to make a transition to a masking optional school approach that started yesterday. This change is hard, and our kids need us to support them and to model how to respect others despite differences. Masking remains a very prudent public health measure, and those who are wearing masks need to be supported. Those who are no longer wearing masks also need support so this single issue does not further drive wedges in our communities. In general, I ask that all of us strive to be mindful of the fact that we don't know what factors are driving the decisions of those around us. If you're not sure what someone is comfortable with, please don't assume. Instead, ask them and respect their choices. This can apply to everything from considering whether to plan gatherings indoors or outdoors, asking about masking preferences when in other people's homes, and planning for the upcoming return to the workplace in ways that respect and consider different levels of risk in those who are impacted by change. One thing COVID has shown us time and time again is how connected we are all to each other and how our actions impact those around us. As we move through this time of transition, I ask that all of us stay mindful of that fact and that we think of others as well as ourselves as we go about our daily lives. Over the last few days, I have heard some reports of people refusing to wear masks in public settings. I want to remind Albertans that until we are in step 2, masking is required in indoor places across the province. Masking is especially important in healthcare settings. Healthcare is different from other public places, and AHS and other healthcare providers will continue to have additional measures and precautions in acute care and continuing care facilities to help protect vulnerable patients and residents. These measures are also keeping healthcare workers safe. I ask all Albertans who may need to access any healthcare facility in the coming weeks to be respectful of the rules in place, even if they're different from other settings. By doing so, you are helping to keep patients, residents, and staff in these facilities safe. Finally, I want to let you know about plans for media availabilities over the next few weeks. My team has tried over the last 2 years to support the importance of personal well-being and self-care for those working on the response. As part of this, we have been working recently to set up a rotation of time away from work, and it is now my opportunity to have some time off. After this week, I will be away for 2 weeks. Minister Copping will provide regular COVID updates to media during that time, and my team will continue to monitor the data and provide input on the response. There will also not be a COVID media availability this Thursday. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw and Minister. No one in the room here, so we'll go straight to the phone. First caller, please.
Thank you. Matt Woodman, CTV.
Hi there. My question is for the Health Minister. When you and the Premier outlined the public health measure changes last week, the Premier said the changes were based on trends in other countries where Omicron had emerged before it had in Alberta and had peaked before it did in Alberta. The UK, for example. We're now seeing many schools in the UK are bringing masks back for kids. Are you worried this is something that's going to happen here as well, even though it was just dropped yesterday?
Yeah, not at this time. What we're seeing generally in a number of those countries, UK, and also we see in trends in Ireland that the numbers are still trending down in terms of both hospitalizations and actually in terms of cases trending down or maybe plateaued a little bit. But we're going to continue to watch it very closely. And as I said before, if we need to make adjustments, we will. But we're going to watch our own data. And we haven't seen a spike in hospitalizations in those countries.
Thanks, Minister. Matt, follow-up?
That's it for me today. Thank you.
Oh, there's a first. Thanks, Matt. So we'll go to the next caller, please.
Thank you. Jennifer Lee, CBC.
Hi, thanks for taking my question. And this kind of dovetails off the question you just had. You know, there is a lot of concern about the decision to lift masking in schools. A number of physicians, pediatricians, infectious disease folks, you know, they're worried about the implications of this decision with only roughly about 20% of kids in that 5 to 11-year-old age range with 2 doses. So how do you respond to their concerns that this is too early, that it could lead to increased transmission followed by increased hospitalizations, and how do you respond to their calls to reinstate that mask mandate or requirement in schools?
Yeah, as we indicated last week when we made the announcement, you know, we did an assessment on a variety of measures, recognizing that the trends were heading in the right direction. Hospitalizations, as I shown earlier today, new hospitalizations have been dropping steadily. And so when we took a look at what are all the measures in place, look at the measures that may be less effective or potential for causing harm. So the REP, we removed that as sort of phase one, but also in regards to masking for children. There's mixed evidence on the efficacy, and concerns being raised about impacting child learning. So this was our first stage. We put a program in place in terms of reducing the restrictions at a very staged approach, so we can actually watch what happens over the next couple of weeks. I understand some of the concerns, raised by parents. There's different degrees of comfort levels, as indicated by Dr. Hinshaw. We are in a transition phase. Some people are, willing and eager to move forward, and others are concerned. We need to be respectful of individual choices, but now's the time to make the transition, move to individual choices by parents and their children, and then we'll watch the data.
Thanks, Minister. Jen, follow-up?
Yeah, I do. Thanks. I think one of the concerns, that we're hearing is that, first of all, that the mask requirement is being lifted, but also that it's not being done in tandem with other measures that might sort of compensate for that. For example, trying to address that low vaccination rate among kids through things like making vaccines more accessible in different places. So, some of the things I've heard is suggestions about, making them available in schools, which I know you've done with the older kids. Even after hours, for example, we're hearing calls about allowing family doctor's offices to provide them, more pharmacies, and even places where kids go often, places like hockey rinks, things like that. So what is your government's intention in terms of trying to make this vaccine more accessible? And if you could comment on sort of each of those types of locations that we're hearing calls for the province to make them available, if you don't mind, please.
No, thanks for the question. No, there are some measures that remain in schools, as you know, cohorting, for example. Those remain in schools. In regards to vaccinations, government, we agree that vaccinations are the best way to protect all of us, and it's not only about coming out of Omicron, although that's the numbers are coming down and we are on the other side of the fifth wave, but it's also protecting against future waves, and quite frankly, we have to normalize vaccines to be able to, like COVID vaccines, just like everyone gets the annual flu vaccine. We may very well need to be moving to that. Now, whether it's an annual or every 6 months, we'll have to wait and see. My focus, and we appointed an advisory committee on vaccination to be able to provide advice to our government and to myself about how do we improve vaccination rates. Kids, it's just roughly 46% for 5 to 11-year-olds at this point in time. We need to get that higher. So we're looking at other options in terms of doing that. When we talked originally about vaccines at school, when we did that for older kids, it wasn't very successful in terms of the rate. But again, we'll take a look at the various different approaches over the coming weeks to be able to support vaccination, because this is going to be with us for a long time. Just like people who get flu vaccines will likely need to get COVID vaccines.
Thanks, Minister. Turns out we only had 2 reporters waiting on the phone and no one else, so that's it. We'll wrap it up there. Thanks, Minister, and thanks, Dr. Hinshaw.
Thank you.